Hi, I'm Dr. Guleria. I work as a senior consultant surgeon at the Apollo Hospital. I essentially specialize in transplantation and currently run an extremely busy renal transplant program at the Indraprastha Apollo Hospital, New Delhi. First, on this day, that is the 8th of March 2018, which is actually International Women's Day and also happens to be the World Kidney Day, we celebrate the fact that both the health of women and I think more important, looking after the health of women's kidneys, both of which play an extremely important role in keeping women healthy. I'd also like to take this opportunity to pay my highest regard to all the women I think who play a wonderful role in making life worth living. Essentially, you must understand that you have two kidneys. Most of us are born with two kidneys. The kidneys are an extremely important organ in your body. They basically control your internal metabolism. They push out the poisons in your urine. They control your blood pressure. They make sure that your bones become strong. They make sure that your hemoglobin is well maintained. However, should you have any disease like diabetes or hypertension, your kidneys can get affected, and it is important for you to go regularly for a checkup, especially after the age of 30 or maybe even 40, to get your blood culture, your blood count, get your kidney function tests done, and a simple test of your urine to see whether you're passing protein in urine or not. If your tests are normal, you're doing well, but you must keep getting these tests repeated every 5 years and keep in touch with your doctor. It's important to remember that if you look after your kidneys, you can actually have a very healthy life in the years to come. I think this is more important for women because we know women have a smaller tube through which they pass urine, and because of this, they tend to get recurrent urinary tract infections. And because they get recurrent urinary tract infections, the kidneys can actually get infected. You can get infection of the urine, and you may need to take antibiotics. It's also important to remember that women who have aches and pains should avoid painkillers, should not take any alternative medicines like Ayurvedic medicines because we know they can be toxic. And you should be very careful about getting CT scans done in which contrast is injected because all these contrasts can be nephrotoxic, which means they can be toxic to your kidneys. So I'd like to compliment and congratulate all of you on International Women's Day. We have a number of questions that we have come up with, and I'll just go through them one by one. What is the sign of the common symptoms of kidney disease? Well, I think the commonest sign that you might notice is that you get up at night to pass urine, or the fact that you notice a little bit of swelling in your feet. So if you get up at night to pass urine more than often, which is more than once, it means that you actually get the first sign that things are going wrong. Of course, later on as the disease progresses, you might notice that your appetite has gone down, you feel like vomiting, you feel very weak, and the signs can be very, very subtle and therefore can only be picked up by a blood test sometimes. So it's important to keep that in mind, that slight swelling, nausea, vomiting, all can be very subtle signs. But one of the important things is to see whether you're getting up at night and passing urine. The other common symptom is that you might notice if you have diabetes and blood pressure is to make sure that your sugars and your blood pressure is under control. There's this wonderful question which says, does excess protein consumption affect our kidneys? It shouldn't, especially if you lead a normal lifestyle, but we normally tell patients to avoid, these high protein packets that you get at gyms. We're not so sure what they contain, and therefore we really tell our patients to avoid them as much as possible. Eat a normal diet, live a normal healthy life, and live a long, long life. What kind of food should we include in our diet to keep our kidneys and liver healthy? Well, you just need to include a normal healthy diet. A good intake of protein, of green vegetables, of fruits, and you must exercise, go for a walk morning and evening, and make sure your blood sugar and your blood pressure are under control. Remember, hypertension and blood pressure are the commonest causes of kidneys failing in the years to come. How long can one live with one kidney? Well, you can spend, if you look after your kidney, you can spend your entire life. Remember the operation that is called a kidney transplant. You can get the kidney from a live donor. And this is based upon the fact that if you take the donor's kidney from a healthy person, he will lead an absolutely normal life on one kidney, which means he will have absolutely no problem. So that's important to remember, that nothing happens to donors. Donors are rigorously screened. We look at them from inside out, and only if we are sure the donor is absolutely all right and will lead an absolutely normal life do we take his kidney. Donors, however, need to follow up with us regularly, maybe once in 2 or 3 years, just to make sure they're doing well. Donors should also avoid painkillers. Otherwise, donors lead an absolutely normal life. Nothing happens to donors. If God wants donors to live for 150 years on 2 kidneys, they'll live for 150 years in 1 kidney. How much water should I take to keep my kidneys healthy is another question we've got. Essentially, you should drink normally about 2.5 to 3 liters of water every day. This is good because it flushes out your kidney. You pass a good quantity of urine, and it makes sure that your systems are working well, and that if you've taken anything that's toxic to your kidney also gets washed out very well. So hydration is absolutely important to keep your kidneys going. Are there any home remedies for kidney stones? Well, it all depends on what your kidneys, what the stone is made of. Stones can be of calcium, they can be of oxalate. But what we normally say is that if you drink less milk, take less of palak, and take less of tomatoes, you should be all right. What is the common non-specific symptom of chronic kidney disease? Well, the non-specific symptoms of chronic kidney disease are essentially weakness and fatigue. You might notice a little bit of swelling on the feet, but that's about it. Does beer actually help in reducing kidney stones? Well, beer does help because beer is a diuretic. You drink a large amount of fluid, and because of that, you wash out you wash out your system. So any stones that are forming will get washed out. What causes kidney disease? I've already answered that. And really, kidney disease, the commonest causes are diabetes, hypertension, sometimes stones, polycystic kidney disease, and glomerulonephritis. But in this part of the world, it's diabetes and hypertension. At what age do we start seeing signs of kidney failure? Well, I think it's important to remember that the signs of kidney disease can occur at any time, but unfortunately in this part of the world, we tend to see them in people in the prime of their life, which means they're in their late 20s or early 30s, when they can be most productive to society, when they've just got married or have just started a family. And therefore, it's important at that time to make sure that we pick up the disease well, we treat it well, and this is usually not because of diabetes or hypertension, but because of glomerulonephritis, or because they've had a bad throat infection, which has led to glomerulonephritis in the kidney. And this can lead to renal failure. They present with very non-specific symptoms, which is actually weakness, fatigue, and you must just notice a high blood urea and creatinine, and that can be it. Should we keep dogs away from a kidney patient? We don't say so, but if you had a transplant, we feel you should keep animals away, because animals sometimes can be the harbinger of infections. However, if the animal is well vaccinated and is kept clean, he can be with you. There's a question from Mukul Bhisht, who wants to know what is the average life expectancy after a kidney transplant. Well, that's a very good question. It's difficult to predict, but we do know that if we keep you on dialysis, you will not last long. If you have a transplant, you will continue living for a long time. The average life expectancy of the kidney can be up to 8 to 12 years, maybe even more. I have patients who are doing well even after 30 years. And provided you take your medicines well, you follow up regularly with your doctor, there is no reason why your kidneys should not work a long, long time. There is no doubt that if you have renal failure, the best treatment for your renal failure is actually a transplant. Should you have any questions, please write to us at info.delhi@apollohospitals.com or log in to delhi.apollohospitals.com and share all your queries. It's such a privilege to be speaking on this, and thank you very much for tuning in. Have a great Women's Day.